Thank you, Mr. Speaker. Everyday Albertans, our families and seniors have watched their healthcare system deteriorate for the past several years at the hands of this government. Today's scathing Health Quality Council report confirms what we've known for years. Physicians have been muzzled and intimidated against advocating for their patients. More than half of the doctors surveyed said that advocacy is limited, and 1 in 5 reported active harmful obstruction in patient advocacy. Will the Premier then finally do the right thing, fulfill her promise, and call it...
The Honourable the Premier. The Honourable the Premier, please.
Mr. Speaker, what we have been saying in this House and the legislation that we passed in the fall will do exactly that, Mr. Speaker.
You're a lawyer. You know better than that. Given that today's report from the Health Quality Council confirms that there has been several instances of doctors' intimidation, and given that we know that there are many more physicians out there who won't give their testimony unless they are given the full protection of a judge, and given that you yourself, Premier, said in June that only an inquiry with subpoena powers can give us the real answers, when will you admit that your inquiry legislation is nothing but bad medicine and finally call it judicial?
The Honourable Minister.
Thank you very much, Mr. Speaker. Well, as we've said, the government has just received the report. We are going to take the time over the next few days to review the recommendations in detail. And, Mr. Speaker, those recommendations will greatly inform the development of terms of reference for the inquiry that has been promised by the Premier. I might also say to the honourable member, Mr. Speaker, that this report makes several recommendations about things that can also be done outside of an inquiry process to improve the relationship and advocacy opportunities for physicians and other health providers. We're committed to that, Mr. Speaker. We'll continue to work with the AMA to make sure that
member, please.
That's a cop-out, Minister. The health professionals in this province do not trust you. Given that Albertans have a right to know the full nature of this government's record on health care, and given that this Premier has known since June that with the allegations of culture of intimidation, there is a reason for a full judicial inquiry, why, Mrs. Premier, have you sat on your hands for the past 4.5 months with broken promise after broken promise while Albertans have been waiting for an answer? Call the full judicial inquiry today.
The Honourable Minister.
Speaker, I don't know how many times we have to repeat the same answer in this House over and over. The government is committed to calling the inquiry. We will take the opportunity to review the recommendations in the report to inform the terms of reference. If the opposition, Mr. Speaker, wants to dismiss the contents of the report, 10 months of work and 21 recommendations, and think they have the answers, they're welcome to express those to Albertans. Mr. Speaker, this process is not about individual members of this House, the government or the opposition. It is about Albertans and their experience in our healthcare system and how we will work to improve that.
The Honourable Member for Edmonton